Hello, everyone. Welcome to the Clinical Medical Assistant Info Session. My name is Keita Bradley, and I am Program Manager for the CE Health Science Clinical Medical Assistant Certificate Series courses. I wanted to take a moment of your time to briefly discuss how to enroll and successfully complete the Clinical Medical Assistant Certificate Series. One of the first topics that I wanted to discuss is what does a clinical medical assistant actually do? Although there are a variety of roles that you can play within the medical world, we'll discuss a few of them here. Your biggest role will be assisting the physician with patient examinations. And not always will you be assisting just a physician. There are times where you'll be assisting nurse practitioners, physician assistants, and other supporting medical staff. And within this role, you're taking patient histories, you're measuring vital signs, giving injections as directed by the physician. Keep in mind that everything that you're doing within the practice world, the medical practice world, you will be doing under the direction of a physician, nurse practitioner, physician's assistant. You are never to stand alone in any type of orders or procedures and medications that you're providing to the patient. You're also going to be scheduling appointments, drawing blood and preparing it for laboratory tests. You're also on a day-to-day regular practicing within the standard of care of a medical assistant. There are a variety of first aid procedures that you'll be performing. You're preparing patients for procedures and treatments, maintaining medication and vaccine immunization records. There are a variety of tests that you will be providing to your patients, but one of the most popular ones within a clinical practice that within the scope of a medical assistant is electrocardiograms. You're also, depending on what type of facility that you're working within, you're assisting with minor surgeries and suturing, and sometimes that's suture removal as well. Always, you're going to comply with local, state, and federal privacy standards. Moving on to the next question that so many of you have. Where does a clinical medical assistant work? There are so many places that you're needed, but here are a list of a few popular ones. Physicians' offices, hospitals, surgery centers, laboratories, medical screening facilities, nursing homes, and physical rehab facilities. What are the admissions requirements? You will need to complete and successfully pass a basic life support course. Our preference is a course through the American Heart Association, and we offer basic life support courses here at Collin College for a fee of $60. You will also need a pre-admissions application. On page 2 of your pre-admissions application, you will find a very detailed checklist covering all of the information that you're needing to know. It also covers all of the items that you will need to have to successfully complete your application. Incomplete applications will not be taken into consideration. We will email you a list of items that you're missing, and you will have a certain time frame to submit that information back to us for consideration. Also on page 2 of your application, within that checklist, will be a list of vaccinations that are required of you. The vaccinations, there are several of them that require you to have 2 doses please keep in mind that any vaccination that requires 2 doses, you will be required to have a waiting period of at least 28 days between those 2 doses. That means that the application process, at a minimum, if you have not already had the vaccinations on the list, can take a minimum of 28 to 30 days to complete. As part of the application process, please also submit a state-issued ID. This can be a variety of identifications. It can be your driver's license or a passport is one of the two main ones that students usually submit to us. Because the vaccinations are such a critical part of the application process, I decided to go ahead and list them here. You will need 2 doses of the MMR. Varicella, you will also need 2 doses. Hepatitis B, 2 doses. Tetanus, 1 dose within the past 10 years. Tuberculosis, a negative skin test or chest x-ray within the past 12 months. Flu vaccination is only required if we're within the flu season. Now, I will say, if you have a vaccination record that you've completed these in the past, please make sure to obtain your record, and you will take a copy of your vaccination record to Blue Star Diagnostics, and they will evaluate them and let you know if you're in good standing or if there's something else that you need. They are available to provide you with the vaccinations for their fee if you are in need of any. If it is better for you to complete these vaccinations with your regular physician, we're okay with that. Just be sure to obtain a copy of your record and take it to Blue Star Diagnostics for evaluation. At the end of the evaluation, once everything is complete and is in good standing, they will provide you with a one-page form that you'll include with your application. You will not include a copy of your actual vaccination record in your application. We will only need the form from Blue Star Diagnostic to be included. The next question that students generally have is, what are the required courses and what do they cost? Electronic healthcare records is a required course, and it comes in at $220. This course is designed to familiarize you with working with medical software. The next required course is your Clinical Medical Assistant Basic course. This is your lecture course, and for fall 2020, this course has been designed as an online course, which means that the majority of your work will be completed online. The Clinical Medical Assistant Advanced course is your lab course, and this course will be a face-to-face course where you will meet on campus for the designated day and time that is listed on your schedule. And the schedule was on the previous slide. You can take a look back at that to see what date, time, and location will work better for your life at this moment. Also keep in mind that the Clinical Medical Assistant Basic and Advanced will have to be registered for and taken at the same time. You cannot take one or the other. You cannot take one and then the other later on. You will have to successfully take and pass both of these courses at the same time. The next course is Health Career Success. This course gets you ready for real life experiences in the work world. It also helps you build a functioning resume, teaches you interviewing types of skills within this class. The last course that you will take in the series of 5 is your Clinical Externship with Exam Review. Now, in your clinical externship, you're also completing a total of 160 hours in a clinical world type of placement. Now, this 160 hours will require you to do a minimum of 15 hours per week. We cannot place you at anything less than the 15 hours per week. So if you're considering any of the medical assisting courses, please carve out time within your schedule for this 15 hours per week. And we can work with you with the times of the day. Most of the clinics require daytime hours. Some of the hospitals will be a little more flexible and offer some evening hours for you. But you will have to be available at least that 15 hours minimum per week. We want you to treat this as if it is a real job, because you are coming in and you're filling in a clinical practice. So you are required to work by the same standards as any other employee within that practice. You are not allowed to just not show up and not call in. So be sure that if you're not able to make a shift, that you're calling in to whoever your clinical manager or supervisor is at the time and let them know that you're unavailable. You can also contact your externship program manager if anything were to come up that would cause you not to be able to fulfill your obligation to this clinic or hospital, whichever setting that you're working within. Your exam review course is just simply an online self-paced course that will help you prepare yourself for your national certification exam, which will be offered through the NHA. Now, with this particular course that you're signing up for, there also comes with it an access code. The access code is a one-time use course that will cover the cost of your exam. Should you fail your exam and need to repeat it again, it does not cover any additional exams. You have access to the study material for a total of 1 year. Anytime after that 1 year, you will either have to register again for the course through Collin College, or you can register directly through the NHA. You will have two Sherpath book options. Your first option is an ebook and access code for a total of $249. Your second option is a black and white hard copy of the textbook and an access code for $314. Each of the books are exactly the same. The only difference is that one of the books is completely electronic and the other is a hard copy of the book. Both of them contain the access code, which allows you to have access to your study and reading material. Expenses. I'm just breaking down some of the expenses that are here. There might be, give or take, a few more expenses. Your total tuition is running right around $3,078. Your books will range you in between $250 to $350. Vaccines can run, depending on what all you need, anywhere between $0, if you don't need anything, all the way up to $500 if you don't have any insurance. Blue Star Diagnostics also requires a $30 fee, and this $30 fee is for verifying all of your vaccinations and putting them into that one-page form that I talked about earlier. The background check and drug screen are also listed here. So it's the BLS card. I told you in a previous slide that the BLS card was $60, or the course is $60. Drug screen, $29. Background check, $45. Most uniforms will range anywhere between $60 to $120. You have to wear black scrubs. These have to be worn every single day. If you are not in uniform, we will send you home. You will get an absence and a 0 for the day. So make sure that you are in your black scrubs every single day that you are within the classroom. These are also the same scrubs that you will wear on your clinical externship when you're working within the clinical practices. Shoes need to be a closed toe, low heel type of shoe. The length of the program. Most students who are completing their externships with the 15 hours per week minimum and all of their courses included here can complete everything within 7 to 9 months. Certification. Upon completion of all of the courses that we've just discussed, the 160-hour externship, and the exam review course. And the exam review course, remember, it's at your own pace. You will be eligible for the clinical medical assistant exam through the National Healthcare Association, which you'll often see abbreviated as the NHA. And I've gone ahead and put a link to their website, which is www.nhanow.com. The CE Health Science CMA Advantage. One of the main advantages that we have when you're completing your program through CE Health Sciences is that there are no standard admissions applications that are required. Keep in mind that when you're applying for a regular credit-based program, you have to meet the standard requirements that Collin College has in place. There is also no entrance exam. There's no high school diploma or GED required. No previous college credit or transcripts required. We have a rolling enrollment with a new course beginning nearly every month. There's less than a year to fully complete your program. We have morning, afternoon, evening, and weekend options that we offer. And if you're eligible, financial aid will cover up to $1,500 of tuition each calendar year. I've included my contact information below. My name is Keita Bradley, and I am the program manager of the CE Health Science Clinical Medical Assisting Program. My email is kbradley@collin.edu. I've gone ahead and included the link to the pre-admissions application, and I've also included the link to the Clinical Medical Assistant web page, and this will have more details listed should you need them. I wanted to include a bit more general information regarding the pre-admissions application submission process. At the time, we're only accepting applications via email. Please submit your 100% complete application with every item listed in the checklist to cehealthcare@collin.edu. Thank you so very much for tuning in, and we're looking forward to seeing you all soon.